The baroreflex provides beat-to-beat regulation of circulatory homeostasis. When this reflex works properly, sympathovagal balance and appropriate regulation of hemodynamics are maintained. For a variety of reasons, some known and some still unknown, in disease states such as resistant hypertension and heart failure, the baroreflex loses its ability to maintain sympathovagal balance and homeostasis. In both of these disease states, the baroreceptors no longer send healthy afferent messages to the brain in response to hemodynamic changes, so the brain can restore homeostasis by establishing a new and appropriate sympathovagal balance. The baroreflex activation therapy system, or BAT system, is designed to restore sympathovagal balance and homeostasis in resistant hypertension and heart failure patients by electrically stimulating the carotid baroreceptors. The BAT system is composed of a pulse generator, similar to a pacemaker, implanted in the chest area, and a lead that delivers electric impulses to the carotid sinus. These impulses are relayed to the brain, which responds by increasing parasympathetic tone and decreasing sympathetic drive, thus restoring sympathovagal balance and homeostasis. When BAT is turned on, the brain receives powerful afferent messages from the baroreceptors and responds by increasing parasympathetic tone to the heart. This causes heart rate to go down, thereby reducing cardiac oxygen demand. Also, the brain reduces sympathetic drive to the heart, dilating coronary arteries and improving cardiac blood flow. In addition, lower sympathetic drive reduces myocardial automaticity, rendering the heart less susceptible to ventricular arrhythmias. With BAT, lower sympathetic traffic from the brain to the aorta and other arteries reduces smooth muscle tone, reducing wave reflections and lowering central pressure more than pressure is reduced in the periphery, such as in the arm. This reduces the load against which the heart must pump and restores the normal physiologic pattern of increasing pressure as the pulse travels away from the heart. The combined effects of BAT on cardiac hemodynamics are demonstrated in the following case study of pressure-volume loops in a hypertension patient. Before BAT, cardiac filling pressure and heart rate are high, while stroke volume is comparatively low, as illustrated by a thin and tall pressure-volume loop. When BAT is turned on, lower afterload results in lower cardiac filling pressures. Heart rate is reduced, but cardiac output is maintained due to an increase in stroke volume. This is illustrated by the wide and short pressure-volume loop. The long-term impact of optimizing hemodynamics with BAT can be quantified by echocardiography. A 100-patient substudy of the RIOS pivotal trial showed that left ventricular mass index fell by an average of 13%, from 117 grams per meter squared to 102 grams per meter squared after 12 months of BAT in a resistant hypertension population. The reduction in mass was incremental to what was achieved with aggressive medical therapy, as patients were taking an average of more than 5 antihypertension medications upon joining the trial. Studies have shown that reduced left ventricular hypertrophy results in reduced risk of cardiovascular events. High sympathetic drive to the kidneys results in constriction of the renal vasculature, thereby reducing blood flow to the kidneys. High sympathetic tone to the renal arteries also impedes the ability of the kidney to buffer high-energy pulsatile blood pressure waves. Excess pulsatility can cause damage to small, fragile vessels where blood filtration takes place. When BAT is turned on, the brain lowers renal sympathetic traffic to the renal artery, which becomes more compliant, thereby buffering blood pressure pulsatility. Clinical data are consistent with a renoprotective effect of BAT. Serial measurement of estimated glomerular filtration rate in patients receiving BAT showed maintenance of GFR with BAT. It is noteworthy that GFR was maintained even in the more vulnerable stage 2 and 3 chronic kidney disease populations. In response to the reduced sympathetic drive caused by BAT, natriuresis, which is water and sodium removal by the kidneys, increases. Improved volume maintenance is a key component of how BAT maintains reduced blood pressure over the long term. Despite lower blood pressure with BAT, the brain causes the kidneys to reduce renin secretion. Thus, BAT modulates the renin-angiotensin-aldosterone system in addition to the sympathetic nervous system, thereby impacting both principal targets of hypertension as well as heart failure therapy.
"37-year-old Annette Lawrence is about to witness her own medical miracle. Her blood pressure, 188/90, is high. But for Annette, today's a good day. She has recorded 228/156. At that level, she runs the risk of massive stroke and death. But watch this. Dr. John Bizignano uses an external switch to turn on an implant placed in Annette's neck. And like magic, her blood pressure drops. With a few tweaks, Annette's blood pressure is lowered to healthy levels.
Jeff, that's remarkable. You've turned it up, what, 4 times?
4 times.
And in a space of minutes, a huge drop in the blood pressure.
Pretty impressive.
And you can't notice any difference at all, Annette?
No.
No? Just chilled.
Today, it's 72-year-old Jean Campbell's turn to eliminate her blood pressure. She had the device implanted about 4 weeks ago, and she's having it switched on for the first time.
We've just taken Jean's blood pressure with the Rios device switched off, and that alarm means her blood pressure is too high. It's 185/90, which is pretty high. Now we'll turn the device on and increase the voltage bit by bit. See what happens. Ready? (146/79).
We'll go ahead and increase the dosage one more time and wait about 4 minutes and check it again.
Our final reading, 117/68. And now, finally, you've got results.
Yes, this is my miracle machine.
Yes.
Jean's so-called miracle machine won't be necessary for everyone with high blood pressure. But with 30% of the Western world suffering, it's a step in the right direction.